today for this briefing, after, of course, the emancipation celebrations that we had over in Nevis. We continue to update you on what is happening in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic, which is still very much with us. We only have to turn on our televisions and look at the news to see what is happening with this virus. Countries that would have opened up and relaxed measures, somehow some of them have to resort to putting those measures back into place because there have been surges in certain countries, certain parts of the world. So we still have to concern ourselves with the virus and try to manage it, of course, as best we could. So thank you for being a part of that effort, and thank you for joining us where we continue to provide you with information so that you can stay safe and healthy. Today, I would like to invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us the latest update with respect to the COVID-19 emergency powers regulations. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Trust we all had a very restful holiday weekend, and we are prepared for the days ahead. Coming off the long holiday weekend, I am very pleased to report that there was no major incident on St. Kitts resulting in injury or death due to road accidents or other accidents, and we are very thankful for that, and we want to thank our residents for their responsible behaviors that brought about this outcome. New regulations were published on August 1st, 2020, and will expire on August 8th. These regulations are an extension of the previous regulations. No changes have been made, hence the nightly curfew remains PM until 4:59 a.m. the following day. Businesses and establishments are therefore required to be closed at a reasonable time so as to give their patrons and staff adequate time to adhere to the curfew. During the week, bars are required to be closed at 10:30 p.m., while on weekends they should be closed at 11 p.m. All COVID-19 protocols to prevent the spread of the disease are still in effect. The wearing of masks in public, social and physical distancing, hand sanitization, and good sanitizing behavior are still the only means to effectively combat this disease and to prevent its spread. Private parties and social gatherings are still restricted in keeping with social distancing protocols. It is necessary and very important that we continue to remind and enforce these restrictions as we prepare for the reopening of our borders. While it may not seem necessary now, given our COVID-19 status, to adhere to the protocols, these are the things will significantly change once the borders are open. These are the practices that will keep us safe. We will do well if we adapt now, as life as we know it a year ago will not be the same. We will have to adjust to a new normal. The very protocols that we are enforcing now are the protocols that would keep us safe, and we advise residents to adapt and adjust and be guided accordingly. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center COVID-19 Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, as per usual, it's my task to share with you the Health Emergency Operating Center's Situation Report for today, August the 5th, 2020. Now, we have been monitoring the COVID-19 outbreak for almost 7 months. The virus has caused many changes. Students have had to adjust to attending classes online. Workers have had to adjust to new routines, working from home. There's an article in the Economist magazine dated August the 1st, which tells us that working hours have increased by 10 to 20% during the pandemic, and stress levels have fallen by more than 10%. At present, based on the World Health Organization, the total number of confirmed cases of COVID-19 internationally now stands at over 18 million. And then in terms of the total deaths, the death count is now over 696,000 globally. What's happening in the United States of America, based on CNN's tracking system, the total number of confirmed cases in the U.S. is at 4.6 million, almost 4.7, and there's a big increase over the past week, an increase of almost 60,000 per day. In terms of the death toll in the United States, it's over 154,000. What's happening in the Caribbean region? As at July the 31st, there is approximately 114,941 cases in the Caribbean region. The recoveries continues to increase, 55,931, and the death toll within the Caribbean region continues to be low. It's only at 1,871, and we really do hope that this trend continues. Now, the Caribbean Public Health Agency issues a situation report every 2 to 3 days, and the report continuously states that the risk of further cases occurring in the Caribbean region remains very high. Now, within the Federation of St. Kitts and Nevis, we continue testing all suspected cases and their contacts, and to date, 1,146 persons have been tested already, and as you know, as we are all aware, we've only had 17 confirmed cases, 16 of which have recovered, and we have 1 active case